So Pete Buttigieg, who is obviously running in the Democratic primary, he's come out with his own bullshit Medicare for All plan. He calls it Medicare for All Who Want It. So stupid. It's like what a absurd and pathetic grifter this guy is. But anyway, he came out with this plan of his, and he's trying to piggyback and grift and leech off of the progressive message. Kamala Harris has done a similar thing. I believe Elizabeth Warren, as I said in the last segment, I believe she's doing something similar as well. So everybody's just trying to grift off of the Medicare for All plan to try and get people, to get progressives, to get leftists to support it. But this is probably one of the worst versions of it, because so-called versions of it. But this is one of the worst and most blatant attempts at pretending as if you believe in Medicare for All, because it's not Medicare for All. And it's very similar to it's very similar to Kamala Harris. It's not as bad as Kamala Harris, because Kamala Harris is just calling hers Medicare for All. That's it. She's just saying, yeah, Medicare for All, Medicare for All. I believe in Medicare for All. So whereas Pete Buttigieg, he's Medicare for All Who Want It. So the guy he's not as bad as Kamala, because Kamala at least is just kind of pretending as if she's a progressive, and she agrees with Medicare for All when she claims, she was asked by Cenk Uygur recently, when she was in Iowa, she was asked, do you support Medicare for All, the form that Bernie Sanders and progressive support. She says, I believe in a public and a private Medicare for All and private Medicare for All. So at least she's, at least Pete Buttigieg is a little bit more honest in the fact that he believes in in a private system existing in Medicare for All, because at least he's not just calling it Medicare for All, he's calling it Medicare for All Who Want It, but it's still bullshit. But anyway, so let's get into the details here. He wrote an op-ed opinion piece for the Washington Post, and the title of the article is, "Here's a Better Way to Do Medicare for All." Medicare for All. And this is from Pete Buttigieg. So let's get into the substance of the piece here. Let's get into the body of the piece here. It says, earlier this year, I lost my father to cancer. I make decisions for a living, but nothing could have prepared me for the kind of decisions our family faced as his illness grew more and more serious. But as challenging as that time was for my family, one thing we did not have to worry about was whether his illness would bankrupt our family, because he was covered by Medicare. We were free to focus on what mattered most. I want every family to have that same freedom, but as anyone who has ever visited a doctor knows, healthcare in the United States remains too expensive, too complicated, and too frustrating. The system seems almost designed to leave us feeling powerless and confused. As president, I will put Americans in charge of their own healthcare with affordable choices for all. I'll ensure that every American has access to affordable coverage, either through private insurance or a public alternative. If a private insurance plan through your employer or the marketplace isn't affordable, you can get a plan that is. It's what I call Medicare for All Who Want It. So let's just stop right there. So this is something that Kyle Kulinski has put forth. This is somewhat Bernie. I don't think Bernie Sanders has officially put forth this idea. I think maybe some of his kind of his supporters and aides and stuff, and people that post on social media and stuff have said. But what Pete Buttigieg is doing here, and this is something he, by the way, did in the last debate that he was in, so the September 12th debate that I mentioned before, he said this in the same exact thing. He says, I want to give people a choice to be in healthcare to have a private insurance healthcare or public insurance. So public insurance being Medicare for All. I want to give people the choice. I'm giving people the choice. This is what I believe in. I believe in giving people choice. So he just keeps saying this. Dude, you're not giving, when you're giving people the choice to be part of a system that is going to screw them over, you're not helping them. You're giving them the choice to be screwed over by a greedy, rapacious, for-profit healthcare system, insurance system, mafia-like system, mob-type system, where they can easily get screwed over by these for-profit companies who just want to make money. They don't give a shit about you. They don't give a shit about about giving you good health care. They just want to make money off of you. And then every now and then they'll throw you a bone with some decent healthcare. But then if you even manage to get decent healthcare, they end up paying you up the ass with copays, premiums, and deductibles, which, as we've talked before, would not exist under a Medicare for All system. This is something that Pete Buttigieg wants to keep. This is something that the establishment Democrats want to keep. That's why they love Obamacare so much, because they want to continue the profits to keep rolling in for those insurance companies. They don't care about what people are going through. They don't care about the fact that they're being screwed over by the insurance companies. They want to keep letting them do to us and do to people what they've been doing. And Pete Buttigieg going out there and trying to say, like, well, we're giving the choice. We're giving you choice. We're totally in favor of choice. Choice is a wonderful thing. You have the freedom to choose. No, I don't want to have the freedom to choose. I don't want to have the freedom to choose whether I'm going to be fucking screwed over or whether I'm going to get good health care. And this talking about all comes from the fact that, the regular people, American people, whatever, people in this country, they love their private insurance. They're absolutely obsessed with their private insurance. Okay, maybe people love their doctors. Maybe they love their hospital, something like that. Okay, fine, you can go with that. But don't tell me people love their insurance. Nobody loves insurance. Nobody loves the companies that are screwing them over. If you've ever, he even said it in this thing. He said that it's too, what does he say? It's too... He says healthcare in the United States remains too expensive, too complicated, and too frustrating. So he, in a way, admits it, but he doesn't say anything about the insurance companies. He doesn't say that the insurance companies are making things too expensive, too complicated, and too frustrating. What he does is he simplifies it and he dumbs it down, and he talks about just healthcare. Healthcare is complicated. Healthcare is expensive. Healthcare is frustrating. Yeah, we know that, but it's also the insurance companies. The insurance companies are the ones that are giving you that access to healthcare, and then with that, they're screwing you over by giving you all the copays, deductibles, and premiums, and then charging you up the fucking ass with ridiculous costs, extra costs, overhead, all that stuff. All the stuff that that's meant to screw you over, the insurance companies are involved in it, and Pete Buttigieg apparently wants to continue that trend. He wants to keep that trend going because he loves it. He loves that system. He loves the fact that these rapacious for-profit insurance companies are screwing you over. So let's continue here. It says, many Democrats have proposed a Medicare for All plan, and while each of us would achieve universal coverage, though you wouldn't, there's a real difference between the plan I'm announcing on Thursday and the ones offered by candidates such as Senator Bernie Sanders and Elizabeth Warren. Elizabeth Warren hasn't offered the same plan as Bernie Sanders. Again, I have to repeat that multiple times. Rather than flipping a switch and kicking almost 160 million Americans off their private insurance, which is bullshit, including 20 million seniors already choosing private plans within Medicare, my plan lets Americans keep a private plan if they want to. So yeah, I'm going to let you keep getting screwed over by these for-profit greedy insurance companies if you want to. If private insurers are unable or unwilling to offer better plans than they do today, they don't. That's the problem. Competition from this public alternative will naturally lead to Medicare for All. You fucking idiot. Stop pretending as if private insurers are totally they're fucking angels, as if they're going to do everything so wonderfully for you and they're going to be trying to do everything they can to help you out. It's so fucking... This guy is such a fucking snake. I can't stand it. And so it continues here, and with my plan, we can achieve universal health care and a public alternative without raising taxes on the middle class. How's that possible? I've always said that anyone who lets the words Medicare for All escape their lips should tell us just as plainly how they plan to get there. The only way we'll rally Americans behind a reform that affects so much of our lives and our economy is if we're honest and straightforward about the details. So I'll be upfront. My plan will cost about $1.5 trillion over a decade. That's it? Paid for by cost savings and corporate tax reform to ensure big corporations pay their fair share. Yeah, you're not going to fucking do that, man. Get the hell out of here. Trying to pretend as if you're as if you're actually going to hold the big corporations accountable. Nobody fucking believes that, man. You're fraud. Anyway, so let's go on to the next part here. It says, my approach isn't just the right thing to do for Americans. It will bring us together rather than push us even further apart so we can achieve our bold objective of universal affordable health care. Why doesn't he... This is what I'm saying. Why don't you just believe in regular universal Medicare for all single-payer health care? Why do you keep talking about getting us there? our bold objective, are eventually getting there, just go to it. Stop talking about how you're going to take all these baby steps. The only baby step we had was Obamacare. We don't need any more baby steps. Just go to it already. And this says lower income people living in states that haven't expanded Medicaid would be automatically enrolled in the public plan. Others without insurance, such as those who forego employer coverage because it is too expensive. Yeah, that's the problem. Or those who do not purchase coverage on the exchanges because they are not eligible for subsidies, would also have access to join the public plan with income-based subsidies. Dude, that's the fucking problem. You're saying this, it says others without insurance, such as those who forego employer coverage because it is too expensive. That's the problem. The employer coverage is too expensive. It's too expensive. That's what we're all talking about. So when all these people say, "Oh, I love my not just my private insurance, but I love my employer-based insurance," no, it's not good. It's not fucking good. And because you know why? Because it's too expensive. And idiot Pete Buttigieg over here, he admits that. Because he's a moron. He admits that outright, but then he continues on with his little fucking charade here and pretends as if his policy is so wonderful, even though he's keeping the rapacious for-profit insurance companies in there and being involved in the employer insurance process too. And then he pretends as if those are so wonderful, even though he admits that they're too expensive, that the insurance that they give is too expensive. Like, dude, you're contradicting yourself here, bro. Either you believe it's too expensive or you don't. So it continues on here and says, we'd also make private healthcare more affordable for the millions of Americans who struggle to pay their premiums. For example, a 60-year-old in Iowa making $50,000 could face a monthly premium of roughly $1,000 for the most popular type of marketplace plan, nearly a quarter of their annual income. Our plan would cap marketplace premiums at 8.5% of a person's income, which means that the same 60-year-old would pay no more than $354 a month for better quality coverage. $354. That's unbelievable. $354 a month just for healthcare. I mean, how do you think that's a good thing? That's just I don't understand. How are you saying something like that and then pretending as if it's like he calls it a bold objective. How do you pretend as if that's like a bold plan? How do you pretend as if like, oh yeah, I'm totally doing something that everybody loves and everybody's going to be behind, and everybody is gonna love, and it's going to be a great policy that everybody supports. Nobody fucking supports that. Nobody who's going to want to go out there and talk about, yeah, I only have to pay $354 a month for healthcare. Wow, that's nothing. I'm totally getting a break here. Get the fuck out of here. And he says, my plan would also take an extra step to reach universal coverage. Again, he says it without just reaching universal coverage, by automatically enrolling those eligible for free coverage in Medicaid or the public coverage alternative. And anyone who falls through the cracks and ends up needing health care would be retroactively enrolled in the public plan. How's that possible? So you're telling me that the people, I mean, I don't know. I'm trying to understand what. So falls through the cracks as in what? Gets kicked off of if this person gets kicked off of their healthcare plan or their private, is he talking about the private plan? I don't understand. If you're talking about their private plan, that's what they do. The private insurance companies kick you off their private plans, and then so his solution is that you will be able to rely on a public plan if you get kicked off your private plan, but you shouldn't get kicked off your private plan to begin with. A public plan would never kick you off to begin. So just do the public plan. What's the point of doing the private plan? See, that's the problem. This idiot, he can't figure out the fact that the private plan is the problem. And then he's saying, well, if you get kicked off your private plan, we'll put you on the public plan. Well, why don't you just cut the middleman out and just go with the public plan? Just do it the public insurance that's going to essentially be Medicare-For-All. Well, not your version, but it would basically be Medicare-For-All, or it would be a single-payer or universal healthcare system. But no, he wants to keep that private insurance in there so that he can continue sucking up to the insurance industry. And then the last couple paragraphs here says that's the only part of our plan, of how our plan would empower Americans. We'd also ban the surprise medical billing that has left patients slapped with 5 or 6 figure bills after a bike crash or a heart attack. We'd limit out-of-pocket costs for seniors on Medicare and ensure that health providers such as hospitals price their services fairly by capping out-of-network rates at twice what Medicare would pay for the same service. My administration would also bring transparency to pricing and reduce the wasteful administrative costs that ultimately get passed down to patients. On top of Medicare for All Who Want It, our campaign will be putting forward additional plans to address issues such as drug pricing, innovation, and health equity. With bold and unifying policies such as Medicare for All Who Want It, let's bring down costs and guarantee coverage for everyone. Let's put power into the hands of each American and create a healthier future for us all. Obviously he finishes off the stupid article with a fucking diatribe and spewing his typical talking points. Not surprising there. And yeah, this plan is terrible. It's not good at all. I don't know why you think like you've broken some sort of progressive barrier and you're doing things that people absolutely support. This guy he's clearly just trying to suck up to the insurance industry and trying to do favors for them. And like I said before in another segment, Pete Buttigieg is a big receiver of the donors coming from celebrities. So, and what do celebrities have? They have private insurance. So when he's getting donor money from celebrities, he's trying to do their bidding. Compared to Bernie Sanders, who's getting the donor money of regular people, over 1 million individual donors of regular people, he's going to go and do things for regular people. They're not going to. These regular people are not going to get on board with a policy that is going to fuck them over. And the more you talk about, like, he's not even making his case that well here. And he's talking about how, leaving patients slapped with 5 or 6 figure bills after a bike crash or heart attack. That's the point. That's what private insurance does. Private insurance gives you ridiculously high medical bills that screw you over. But this guy's talking about how we're going to ban the surprise medical billing. How about just not having them at all? You can't just ban them. That's what private insurance does. Private insurance forces you to receive high bills and big copays and big deductibles and big premiums and ridiculous medical costs. This guy wants to talk about banning medical billing, surprise medical billing. So, but if you have Medicare for All, you're not going to get any medical billing. You're not going to get any of those surprise medical bills. You're not going to have to deal with that kind of shit because it's all funded by taxpayers. Yes, Bernie Sanders' plan is funded by taxpayers. It's going to be funded by middle class tax cuts and majority by the super rich tax cuts. I'm sorry, the raising of the taxes of the super rich and wealthy. Middle class tax cuts are going to go up, but they're not going to go up as high as the super rich. I already mentioned this before. That's how Bernie's plan works. So, but his plan is he just wants to do just barely enough that's going to get people on board with this shitty plan, and then he's going to end up screwing them over by not actually doing what they are demanding. So when it comes to the whole existence of private insurance, this was something, and this is a clip I played before of Cenk Uygur explaining why it's bad for the public insurance to exist the private insurance to exist along with the public insurance. So watch this segment. He explains it really well, and I played this clip multiple times before because he explains it best. And check this clip out, and then you'll get a better idea of what I'm saying.
So in terms of the Medicare Extra, their number one problem right now, policy-wise, is if you set up that private insurance option, they'll take the healthiest Americans because they have a profit motive, and they'll drive down the prices for those healthiest Americans. But that's not how insurance works. That ruins the insurance pool, and then they unload all the costliest, sickest people onto Medicare, and then go, oh, can you believe how much it costs? It's a trick. Don't fall for it.
See what they do? This is how they operate. This is why the health insurance companies are so fucking corrupt and so hated, and the fact that people call them, oh, they're so wonderful and everybody loves their private insurance. No, it's bullshit. They're not out there to look for your best interest. They're out there to go and make a profit. So anybody that talks about how they're going to be doing what's in your best interest is bullshit. So I just want to play this clip from Pete Buttigieg making an appearance on CNN, where he explains his plan a little bit more thoroughly. I think it's like a 2 or 3 minute clip, and then check this out, and then we'll talk about it on the other side.
Healthcare, the number one issue on the minds of many Democratic voters. You introduced your new Medicare-For-All Who Want It healthcare plan today. That's what you call it. It includes a public government option for healthcare, or lets people keep their private insurance if they want to. Now, you wrote in a Washington Post op-ed, quote, "With my plan, we can achieve universal health care and a public alternative without raising taxes on the middle class. I've always said that anyone who lets the words Medicare for all escape their lips should tell us just as plainly how they plan to get there." You seem there to be accusing some of your rivals of not being upfront about how they intend to pay for Medicare for all. Stephen Colbert earlier this week seemed to suggest that Senator Elizabeth Warren wasn't being upfront.
You know, Senator Warren is known for being straightforward and was extremely evasive when asked that question. And we've seen that repeatedly. I think that if you are proud of your plan and it's the right plan, you should defend it in straightforward terms. And I think it's puzzling that when everybody knows the answer to that question of whether her plan and Senator Sanders' plan will raise middle-class taxes is yes, why you wouldn't just say so and then explain why you think that's the better way forward. Our plan does not require raising middle-class taxes. It does create a way for everybody to be covered. And I think that's what most Americans want. Look, people are used to Washington politicians not giving straight answers to simple questions. But at a time like this, on an issue this important, that's exactly what we need.
Your health care proposal seems to share a lot with that being proposed by former Vice President Joe Biden. How are they different? Why would yours be better?
Well, first of all, I don't think that it's enough to simply build on the ACA. Certainly the ACA was a leap forward, and we should be thankful that the Obama administration delivered that. But we know that far too many Americans are finding that they still can't get good insurance, or when they have insurance, affordability remains an enormous problem. We're seeking to attack the problem of affordability from several angles. Insurance, but also looking at what's driving those costs in the first place. And I really do believe the public alternative will be better. It could well be the glide path that leads to a Medicare for all environment. I just don't think it's a good idea to command Americans to adopt Medicare for all, whether they want it or not. Under my plan, if you prefer to keep your private insurance, you can. I just think that ours will be better, and if we're right, then Americans will decide that for themselves.
So again, I mean, he's obviously just saying the same exact thing he said in his article, so there's not much to get on there. But the reason why I wanted to play this clip was because of the part where he mentions Elizabeth Warren admitting that she won't raise taxes, basically, not admitting that she's going to raise taxes to fund her plan. And she's right on that. She won't admit it. Or at least she won't give a straight answer. Bernie Sanders admits that. And notice he doesn't mention that Bernie Sanders says that he won't have to pay copays, premiums, and deductibles. So Pete Buttigieg and other corporate Democrats, they avoid that talking point that Bernie Sanders puts out. Obviously, Elizabeth Warren just won't say it because she either doesn't believe in Medicare for all, even though he claims she does. She either doesn't believe in Medicare for all, or that's not what she's going to do. But Bernie Sanders says, and he's the only one that's saying it, that premiums, copays, and deductibles will be gone if he raises taxes if he raises taxes as president when he implements Medicare for all on the middle class. So on middle class will get their taxes raised, but they won't have to pay all those other taxes that they receive from the insurance companies. And that's the best explanation I've ever heard. And again, Pete Buttigieg going out there and talking about how he wants to give people a choice to have their private plan, which AKA is a choice to get screwed over by the big corporations insurance companies, greedy, rapacious insurance companies, mafia-like insurance companies that are screwing you over. If you want to have an opportunity to get screwed over by those people, go with Pete Buttigieg's plan. Go vote for Pete Buttigieg. Go vote for the guy that's getting donor money from celebrities who have private insurance and want to keep their private insurance. I guarantee there are not majority of people out there who are talking about how they want to keep their insurance. Do they want to keep their doctors? Yes, they do. That's perfectly fine. Keeping your doctor is different than keeping your insurance. And I covered a poll a while back on this show about how people would be willing to get a Medicare for all, have a Medicare for all system as long as they can keep their doctors, not keep their insurance. Nobody is begging to keep their insurance. So Buttigieg is just a fraud, and he, again, he's not as bad as Kamala Harris, who's going out there and calling her plan Medicare for all when it's not. At least he's being honest in a way and saying people for Medicare for all who want it. But people want Medicare for all because it has tons of support. When you look at the polls, you look at the poll numbers, it's upwards of 60%, almost 70% polls. It's even supported by a plurality of not plurality, but actually a majority of Republicans, just barely a majority, 50, somewhere in the 50s, and just over 50% by Republicans. Whereas while Democrats support, I think, like 70%. And even if you ask the most ardent, Democratic loyalist voter out there, they're going to say, yeah, universal coverage, I love it. Universal coverage is wonderful. I want it. Yeah, it's great. But they don't support Bernie Sanders' plan because they think Bernie Sanders is too radical. They like Buttigieg's plan because he's a Democrat. If Bernie Sanders was a Democrat, they would have loved his plan. But the fact that he's not a Democrat and he goes after the Democrats for their shitty Obamacare plans, which, as usual, another Democrat, in this case Buttigieg, praising Obamacare, praising Obama and Obamacare, they love that shit. They love Obamacare for some stupid reason, but in reality they shouldn't, because Obamacare still maintains the existence of the insurance companies who continue to screw over regular people. Bernie Sanders does not want that to happen. Pete Buttigieg does, because he does not have support. He does not have the support of regular people as much as Bernie Sanders does. Bernie Sanders has that, and that's why he believes in the healthcare policies that he does.